And next, you're going to be hearing from Abner Mason, the founder and CEO of ConsejoSano, on their real-time digital approaches to advancing health equity. And with that, I will turn it over to Abner.
So I'm a founder and CEO for ConsejoSano. We are a patient engagement and health plan and member engagement company, really focused on health equity and helping our clients to achieve health equity for their members. The way we do that is trying to create a more personalized engagement experience. We don't believe one size fits all is going to work anymore. Unfortunately, that's the way most of healthcare operates today. We think that if you can understand who people are at a deeper level, use technology and data to do that, and then deliver a more personalized, customized engagement experience that builds trust, we can navigate people into healthcare at the right time and at the right place. And that's what we're doing at ConsejoSano. My vision of moving the needle to advance health equity really focuses on three key areas that I think are really important for us to, if we're going to get the kind of progress that we are seeking. So first, I think we've got to figure out a way to create incentives for healthcare stakeholders, especially health plans, to close care gaps, especially health disparities that are connected to race, ethnicity and income. So that's number one. We've got to figure out a way to incentivize properly. I think secondly, we've got to figure out a way to make healthcare in our country have a better experience with consumers, meaning offer a better experience with consumers. Other parts of the economy are doing a better job of creating a user experience that works for people. Healthcare just doesn't. And I think one of the places that we could start is in how we communicate with health plan members and with patients. Specifically, I think we've got to meet people where they are, and that involves text messaging. We found that that's a key way to engage people. So that's second. We've got to create a better user experience, and I think text messaging is the right place to start. And then third, I would say we've got to figure out a way to do a much better job at investing in the social determinants of health, in these upstream factors that we know really have a much bigger impact on people's health than what happens in the clinic or a doctor's visit, once or twice or even 3 times a year. So those 3 areas, I think if we could make progress, I think we'd be moving a big step forward. So let me just talk about each of them briefly. When it comes to incentives for plans, key to this is that we've got to start to collect race, ethnicity, and language data. If we don't do that, and it's 2021, almost 2022, and we're still not collecting that data the way we should, and when we don't, we know anecdotally that there are enormous health disparities that exist. But if we can't put metrics around that, if we can't measure it, figure out a baseline, figure out what the disparities are, and then invest, and then be able to measure whether those investments really work, I don't think we're going to achieve the goals that all of us want for healthcare. So we've got to figure out a way to incentivize key stakeholders, and I think health plans are really key here to close care gaps. And one thing that's exciting is that for the first time, plans are starting to really give this a lot of attention. And NCQA, which is a group that a lot of the plans look to, it creates ways of measuring how plans are doing. They are developing new standards. They've got a new accreditation that is based on health equity, and it's going to ask plans to take a close look at how they're closing healthcare disparities. And they're even going to tie quality measures. So quality measures are how plans, are measured. They're going to tie those measures to closing these care gaps and reducing disparities. So think HEDIS measures in Medicaid and star ratings in the Medicare Advantage program. These are what plans, how they're measured, is how they're paid. And so if we can create a situation where plans are incentivized to close these healthcare disparities, they get paid more money that allows them to invest more in these programs. We create a flywheel effect. I think that's really important for the future. And I want to, give some applause to the NCQA for taking that step. So the second area is how we engage with healthcare consumers. It's just a shame that, again, we're at the end of 2021 and health plans across the country still can't text their members to help that member to engage in their own healthcare. Because of an old law from 1991, that prevents, it's a federal law that prevents plans. It basically says if a plan texts someone without permission in advance to text that person, they'll be penalized financially. That law is old, 1991. America today communicates via text message. 97% of adults in America, text weekly, and particularly for low income and underserved communities, this is the only way they engage. And so for plans to be prevented from communicating with their members in the way the member prefers makes no sense. And we have got to solve this problem. I had hoped it would be in 2021. Now I'm hopeful that we can solve it in 2022. I think one of the things I'm really pushing for is some guidance from CMS. I don't think we can change the federal law because the Congress is what it is, and that's a tough thing to do. Getting anything through Congress is difficult. But I think some guidance from CMS that sends a clear signal to health plans and Medicaid regulators in particular, that texting is a health equity issue, and they need to use every tool available to them to make sure that plans are able, the Medicaid managed care plans are able to engage with their members via this communication method. That would go a long way toward increasing health equity and allowing us to engage with people in the way that they prefer. And then the last area I'll talk about is the social determinants of health. We all know the data is clear. 80–90% of a person's health is determined by these other factors, not what happens in the clinic, but do they get healthy food? Do they have clean water? Do they have clean air? Are they able to get transportation to preventive services? Also education. There's a big correlation between health and education. These upstream factors, we've got to figure out a way to connect them to healthcare, but not in a way that medicalizes these areas, these social services. I'm not saying medicalize social services, but we can't have silos. The siloed approach that we have now just isn't working. And we've got to figure out a way to have communication and integration without medicalizing. And frankly, we need more investment in these upstream areas, these social determinants of health. There are a lot of technologies now that allow us to track better and to figure out what needs people have and to make sure they get help, but we're just scratching the surface. I do think there's a positive sign. The Medicare Advantage program has started to make a program available called the supplemental benefits, which allows Medicare Advantage plans to invest in these upstream issues for their members. That's great. And I think we're just at the beginning of that. I think it's going to show great success. But we need to have Medicaid plans able to have the same flexibility and not have to go through onerous, 11, 15 waivers like some states have to do in order to use some of the premium dollar to invest in those upstream issues. These three areas, I think if we could make progress there, I'm really optimistic about what we can accomplish when it comes to health equity, because the truth is right now, we have more people who have knowledge about these disparities and the need to address health equity than we've ever had before. We have more support from the corporate sector. We have more support from the government at the federal and the state level than we've ever had before. We have better tools. We have better technology. We have more data. This is our moment if we take advantage of it. So I am optimistic about what we can accomplish, but sometimes people miss the moment. This is our moment, and I hope we won't miss it.